colleagues, welcome very much to our first webinar for this year. Once again, I want to begin by saying Happy New Year to all of you and everyone who is in this meeting. So this is our first webinar for Passcode Global Consultants. And we began this webinar series last year, January. We've been calling them Nurses Empowerment Webinars, just to give us information about the global opportunities that are available for nurses. And I want to welcome you all very, very much and to say Happy New Year. You can check the chat box and greet everyone. Just say Happy New Year in the chat box, just to be able to be together. I see attendance from various regions. I see attendance from Nigeria already is there. Hadija, my good friend Hadija from Nigeria is in. I see attendance from Ghana, and most definitely the largest delegation is from Kenya. So can we greet each other in the chat box? Just say hi, Happy New Year in the chat box. As we wait for a few more people to join in, then we begin officially, probably in the next 2 minutes. I would like to greet you all in the chat box. And as you tell us Happy New Year and you greet us, tell us where you are joining from. If you are from Kenya, you can give us specific the town you are joining in. If you are from outside Kenya, that is Nigeria and Ghana, you can tell us Happy New Year, listening or joining in from Nigeria, Ghana, whichever place you are in. We would really love to hear where you are joining us from. I see Kakamega, Kenya, Naomi Bed, thank you very much. Karibu sana. I see Catherine. I see from Meru, Kenya, Brigitte. I see from Nairobi, Kenya, Catherine, again, Grace Kwamboka from Nairobi, Kenya, and Betsy from Nairobi, Kenya. Karibu sana. Welcome very much to the first webinar of this year. Masi Njiru from Nairobi, Kenya. Karibu sana. Do we have any more people? Where are our friends from Ghana and Nigeria? I don't see your chat in the chat box. Oh, from Philippines. I see Diane from Philippines. Happy New Year to Diane. Alexandra from Nigeria. We greet you. Thomas from Nairobi, Kenya. Karibu sana. And just let you know, as you join in, you ensure your mic is on mute. For the sake of order in the meeting, we'll be beginning in the next 1 minute. Thomas from Nairobi, Kenya, karibu sana. Do we have any more people greeting us in the chat box? Yes, Mary Oduor, I believe that one is from Kenya. Welcome very much. Happy New Year, Mary. Oh, I see Ferdinand. Ferdinand from Kenya. Ferdinand is a clinical officer, if I'm not wrong. You can correct me kindly in the chat box if I'm wrong. Bosongo, karibu sana. That is from Bosongo. That is Mike from Bosongo, Kenya. Bernard from Eldoret, Kenya. Welcome very much. Cosmas, Nairobi, Kenya. Wow, the house is big today. Ferdinand Nyambuto, this is from Kenya, a nurse officer in turn. I see Noraline Albutra from Philippines. Welcome very much, Noraline. Today we are going big, we are going global. Oh, this is so encouraging and beautiful. And now we are about to begin. Just it looks at 7:41 p.m. East African time. That should be 4:51 GMT time and 5:51 West African time. From Kawere, Kisumu, Kenya. Welcome very much. Maimuna Abdi from Kenya. Karibu sana. We've really missed you, and we've been looking forward to having our first webinar for this year. Anybody else greeting us in the chat box? If you see somebody that you know in the meeting, you can Give a shout out to them. Welcome very much. Maimuna from Kenya. Well, dear colleagues, and both senior and junior, we welcome you very much to our first webinar meeting. These are webinar series that we've been having since the year 2022, January. It's a webinar series that we are organizing together with Passcode Global Consultants. And the aim or the sole purpose of these webinars are to appraise you nurses or us nurses with information about global opportunities for nurses, not just nurses in Kenya. Now that today's meeting is a little bit regional with our friends from West Africa. What are the global opportunities for nurses in the global market? We are able to read the 2021, market labor analysis for healthcare workers and specific nurses. Together with it, read also the nurses healthcare workforce report of 2020. You'll be able to appreciate that there's a lot of opportunity for nurses outside our region. And one of the things that we've been tackling in this webinar series have included what is the pathway for nurses to get jobs or to access the United Kingdom market, the Australia market. And in the past 4 months or so, we've been exploring the United States of America markets. And the last 3 months, beginning September of 2022, we've been looking at Nclex. How do you prepare yourself for Nclex? And for those ones who may be aware, is that right now Nclex has a new generation of exams that if you are a nurse preparing to become a USRN, you need to appraise yourself to this information. So the objective of today's webinar is to appraise us with the new generation webinar, the new generation Nclex exams, so that you are able to be at par once you begin preparing for your USRN journey. And with us, we have 2 speakers that are going to speak to us today, now that we do not anticipate to spend more than an hour. And the first speaker will be Dennis, then we'll have Humphrey. They'll be able to introduce themselves better. So Humphrey, I think I'll begin with Dennis. Dennis will come and talk to us about Passcode Global Consultants, probably for 3 minutes. Tell us what Passcode is, what they do, and the purpose of this webinar, which I've also explained. So Dennis, if you are there.
Thank you very much, Donald, for giving me this opportunity to talk to our potential clients regarding this webinar on USRN. I'm kindly requesting you to give me the co-host rights so that I can share my presentation.
Oh yeah, sure.
Yeah, kindly do that. So everyone, thank you for finding time and joining our webinar. These webinars, we do them for free so that you can get insights on the USRN process. So I'm going to take you through what we as Passcode does, how we work with you step by step until you are a registered nurse in the US. Donald?
Just a minute.
Okay.
I'm asking Humphrey to make you the co-host.
Okay. So, so you feel free to ask any question that you may have regarding what I'm going to present and basically what we do as Passcode. So confirm that you are seeing my shared screen.
Yes, Dennis, you're able to see your screen.
Okay, so I'm going to proceed with what us as Passcode does. So basically, we are as I've stated, my name is Dennis Wakonyaribo. I am the program administrator, and I've also shared my contact there regarding what I do in Passcode. So basically, we are a nursing supporting agency that supports nurses all over the globe to ensure that you can be able to work anywhere in the world. And for this case, we are talking about the Nclex RN journey process, that is being registered nurse in the US. So basically, one of the services that we usually offer is managing online learning portal. So we have an online learning portal that our clients are able to get the Nclex RN revision materials together with the Zoom classes in case maybe you missed a class or maybe you are held up somewhere, workplace and all that. Another services that we do offer is the CGFNS services. Basically, you all know that, or maybe you are getting this for the first time, that you have to get the CS report. That is the report that will enable you to do. That is the first step that you will have to do, so that you will be able to sit for the Nclex exam. So we create the CGFNS profile for you, and we also manage the profile for you. Also, in case maybe you need the CS report at Internet services, we're able to guide you on how to go with the GSA evaluation services. Another key process that we do undertake is the US Board of Nursing application. We usually do application to our clients who are seeking to register with the Board of Nursing in the US, maybe the Texas and all that, because that is a basic step that you will need to do so that you'll be able to get the ATT, that is the authority to test. We also do fingerprint application and submission. You are aware that one of the requirement of the Board of Nursing is that you submit your fingerprint to them. We also register with Pearson View. This is the body that provide the Nclex exam. You need to register with them. You are able to do that with you. Also, for those who are maybe they're not around Nairobi, we also take the CGFNS form to NCK for verification. So maybe you are like in Mombasa or maybe in the upper parts of Turkana or Baringo, and we are not able to reach Nairobi, you can be able to take the NCK forms for verification. Thank you for your time. That is basically I've gone through all the key services that we do offer as in my section, in my department as the program administrator. Thank you, Donald, and I appreciate for your time.
Thank you very much, Dennis. It's always good to meet with you here and conference together with you about Nclex and what Nclex does. I believe the past 1 year has been quite a busy year for Passcode global consultants, especially with the influx of clients. And I will be glad to hear more success stories from nurses who are taking up your services to begin their journey either to the United States of America or UK or any other part of the country for which they have so much desired or prepared for. Once again, I'd like to remind us that today's meeting is a little bit regional. We have representation from both Kenya and also West Africa. I see quite a good number of my friends from Nigeria and Ghana who have been able to attend today's meeting. And I welcome you very much, this being our first meeting for this year. And for those who are not here from the beginning, we said that today's meeting is going to focus on the new generation of Nclex exams. Remember, Nclex is always evolving. The type of questions are always evolving. The type of knowledge being tested is always evolving. And you as a nurse who is preparing to go to USA or Canada or any other country that requires you to have Nclex, this time you also have Australia, we will really want to appraise yourself with this information. So to give us the cake icing, this will be Humphrey. I know, Humphrey, you have a presentation. So Humphrey is the CEO and the founder of Passcode Global Consultants. He's going to describe himself better before making his presentation. Humphrey, karibu sana. Meanwhile, if you have any questions throughout the presentation, kindly please post the question in the chat box, and it will be handled towards the end of the presentation. Welcome very much, Humphrey.
Thank you very much. Donald, I hope and believe that everyone can hear me. Please confirm to me whether I'm audible enough so that I can be able to proceed.
Loud and clear, sir.
Thank you. So first of all, I want to say hi to everyone. Happy New Year. Karibuni sana in this webinar. Welcome so much. I will request that those who have unmuted themselves to kindly mute themselves so that the others can be able to hear what we are saying. First of all, I want to start by thanking every one of you for finding time to attend our meeting. We do not take it for granted when you attend our meetings. And at Passcode Global Consultants, we regard you as our pillars. And at this point, I also want to take this chance to thank you so much for spreading the word about Passcode. I mean, telling others about Passcode and what we do here, because from where I sit, I believe that what we are doing is very noble. My name is Humphrey Nkonge, for those who do not know me. I'm a registered nurse in Kenya, having studied at the University of Nairobi, School of Nursing, graduated, passed all exams that Nursing Council needed me to do, and I got my registration in Kenya in the year 2014. Also a registered nurse in the US, in the state of Texas, and I'm glad for the achievements that I've been able to make. My US RN journey is a long one. Probably I'll be able to share it one day, but I've come out of that journey with a lot of lessons, and I feel good whenever I'm sharing information about the same. Yeah, so my introduction, before I go to the new generation Nclex, as I thank you also for sharing our what we do, I want to recognize people who are joining us from various parts of the world. We acknowledge some of our clients who are in the UK, transitioning to go to the US. We also got some people taking our services from France, something we actually didn't expect. And Ghana, Nigeria, South Africa, you are much recognized in this platform. So we are going to look at new generation Nclex. One thing we do at Passcode is that we invest a lot in research, and that is actually reflected in our name. If you look at our name, we are called Passcode Global Consultants. One thing we believe is that a consultant is a person who should be very knowledgeable in the area in which they specialize in. So one thing we emphasize to our staff is that they must do a lot of research on emerging issues and keep updated with what is happening around what we do. Like recently, the most recent change that has happened in the Nclex, apart from the new generation Nclex, which we are going to be talking about, is that CGFNS has reviewed their rates upwards. The CS report that we were purchasing at $420, which actually was an upgrade from $380, that did not last even for a year, has now been reviewed again upwards to the disadvantage of most of our members or all of our members to $450. So if you're looking for an organization that will always give you up-to-date information about nursing, that is Passcode Global Consultants. And we believe that by doing so, we are able to help so many nurses to achieve their dreams. So without much ado, let's go to the new generation Nclex and look at it and what is changing. So people might be asking, why are we talking about new generation Nclex? We are talking about new generation Nclex because the Nclex changes after every 3 years. the change for the change we are talking about now has been delayed actually a little because of the effects of COVID-19. The Nclex that is being done right now up to the end of March 2023 came into effect in 2019. So it was supposed to be done for 2020, 2021, 2022. However, a review was done in 2020, towards the end of 2020, as a response to the pandemic, COVID-19 pandemic. And that was not the major change that they do after every 3 years. That was just a measure to respond to COVID-19. But all through, they have been doing, implementing a change or coming up with a change that they will implement, which is called the new generation Nclex. So any person who is preparing for Nclex and they are not going to get, they will not be able to get their authorization to test ATT, but to be able to schedule their exam in January 2023, because we're in January, there is still time. In February 2023 or in March 2023, they will have to do the new generation Nclex, which has a lot of changes, and which means that they will have to study for some time before they can do their exam, maybe 2 months. So I do have a presentation which I'm going to share. And probably I'll ask for the intervention of our moderator or able Donald. I don't know why I can't see the button for sharing. So please check who has the rights so that at least I can be able to share the presentation kindly.
Yes, just a minute.
Okay.
You now have the admin rights. You're able to confirm if you're able to share.
Okay, just a minute.
Meanwhile, as Humphrey is sharing his screen, remember, as you join into the meeting, ensure your screen is on mute. And if you have any questions to in the meeting, just make sure you write them in the chat box. If you have any contribution, post them in the chat box, then you'll be able to handle them towards the end of the meeting. So Humphrey, we are able to see your screen, and you can go ahead. Thank you.
All right, thank you. So this is a presentation for the new generation Nclex, which is going to be administered from the 1st of April, 2023. So first of all, let us ask ourselves, what is Nclex? So Nclex stands for, some people like calling it Nclex, Nclex, I'm not sure about that, but it doesn't matter how you call it, provided that you're able to understand the questions and pass the exam and become an RN, a registered nurse in the US. So Nclex stands for National Council Licensure Examination. Most of the countries have nursing councils. So the General Council for the whole of United States is called NCSBN. NCSBN stands for National Council of State Boards of Nursing. So what happens in the US is that every state has their own council of nursing, which is called a State Board of Nursing. For instance, if you're talking about Florida, it will be the Florida State Board of Nursing. If you're talking about Colorado, it will be Colorado State Board of Nursing. So all these boards of nursing have come together to form what is called National Council of State Boards of Nursing. And this is the body that is responsible for the Nclex, because Nclex is a standard exam that is used to give to licensed nurses in the whole of the United States. It was adopted in Canada. So nurses willing to practice in Canada will also need to take Nclex. And recently in 2022, Australia has adopted the Nclex as their gateway to licensing nurses who have studied outside Australia. So to me, Nclex is like an international passport for nurses that allows them to practice in the whole of North America, market population of about 400 million people, and Australia, you can still use the Nclex. Now, the outgoing version of the Nclex, as I have said, has been administered for 2019 to 2022. And the number of questions in the Nclex that is outgoing were 75 to 145 questions. That means when you sit the exam, you have to do a minimum of 75 questions. That is where the computer will start determining whether you have passed the exam or not. We usually have a lecture that we do that is called How Nclex Works. It's a whole explanation of about 1 hour and over about how the Nclex works because it's a CAT. I'm going to talk about that in a few minutes. Yeah, so actually this was an upgrade because before September 2020, those who did the Nclex were doing up to a maximum of 265 questions, minimum 75, maximum 265 questions. So this was like a relief when they moved from the maximum of 265 to 145. So the new generation Nclex debuts in 1st April 2023, and it will be implemented up to March 2026. So if you don't take the new generation Nclex and you'll be doing your Nclex after March 2026, then you'll be doing a new version of the Nclex altogether. Another new version, that is. The number of questions in the new generation Nclex will be 85 to 150. So you have to do a minimum of 85 questions. We are now moving from 75 to 85 questions. Now, the current Nclex question types. Why do we have this slide here? We have this slide here because for the people who have not familiarized with the Nclex, we need to understand what types are in the Nclex right now so that we can know what is changing and how the exam is changing. So the main type of question in the Nclex is called multiple choice question. I believe all of you, majority of you are familiar with the multiple choice question. The only difference is that the multiple choice question for the Nclex is a bit tricky. It's not a direct question. It needs critical thinking, clinical reasoning, and clinical judgment. You must apply your knowledge to do critical thinking for you to answer that question. You cannot just answer it with elementary knowledge, because if you do so, you're going to fail. Another type of question in the current Nclex is called a SATA, select all that apply question, which is nicknamed SATA. This is a question type that people don't like because it's a question type whereby you can have more than one answers. It's a multiple choice question, but instead of you selecting one, you don't know the number of answers. So they will give you like 5 options or 6 options, and they will not tell you how many answers are there. So the disadvantage of it is that you must choose all the correct answers. If you choose more than the correct answers in the current Nclex, you fail the question. If the answers are 3 and you choose 2 correct, 1 wrong, you fail the question. So that was kind of unfair. You will see what has happened to it now in the new generation Nclex. The next type question, which is a bit rare, is hotspot question. Hotspot question is whereby they bring you a photo and then they need you to mark. They ask you about something and they want you to mark. For example, they can bring a picture of maybe a bare chest, and then they will, the software they will be using will allow you to mark with an X, where, for example, you get to listen to the heart sounds or maybe lung sounds, maybe a particular heart sound, something like that. That's what is called a spot question type in the Nclex. It's there, but it's rare, not very common. So audio or video question, they can bring you an audio, for example, lung sounds. Maybe they can bring you ronchi, for example, or a wheeze. And then they can ask you to identify the sound, or normally they don't ask simple questions like identify the sound. They make it a bit complicated, like they ask you to describe the sound. So there are some words that are used to describe a ronchi that differentiates it from a wheeze. So it will be upon you now to be able to identify and also recall the words that are used to describe. a multiple choice question with graphics. They can bring a question, but now the answer options will be graphics or pictures. So you choose one picture. For instance, they might be asking you about nursing positions. Maybe a client who has undergone a lumbar puncture. And then they ask you, after doing the lumbar puncture, in what position should the nurse place the client? So instead of listing the positions for you, they bring you the pictures. So you choose one of the graphics. Another type of question they can bring is a graphic. For example, EKGs, ECGs, they can bring an ECG strip, maybe for ventricular tachycardia or ventricular fibrillation. Then they ask you, the nurse did this and this and this for this patient. After seeing that rhythm, what should the nurse do next? Or what should the nurse do first? Or what is the best action by the nurse? So it will be upon you to know this is a VTAC, then you are able to interpret the ventricular tachycardia so that you can make a decision as an RN. So the other type of question they bring is a drag and drop. Drag and drop question is type of question whereby they give a list of questions, a list of steps on one side, and then you have to arrange those steps on the other side. So you will be dragging the step, then you move it to the other side. And what they're looking at here is whether you know how steps should follow one another in a procedure, in a nursing procedure. Some of the common procedures that may have been asked in the current Nclex include catheterization, both male and female, tracheostomy suctioning, or tracheostomy care, and so on and so forth. The other type of question is fill in the blank calculations. They bring mathematics. For example, when you are doing drug administration and you have to calculate the dosage, they usually also do that. They can bring that. Then instead of giving you options like in the MCQs, then they will give you a gap. Then you fill the gap. You write your answer there. So those are the common types that we have today in the current Nclex. All right. So let's go to the next slide and see what is there. So what is not changing? Before we know what is changing, it's important for us to know what is not changing in the Nclex. So the first thing that is not changing is the nature of the exam. The current Nclex is administered as a CAT. In full, this is computer adaptive testing, CAT. So the difficulty of a question will be determined by your result of the previous question. So what happens in computer adaptive questions is that the computer adapts to your level of knowledge, okay? So that when you do the first question, you get it right, the computer is going to give you a harder question to try you and to see in which level are you operating from. If you fail the first question, the computer is going to give you a lesser difficult question. If you fail the second question, it will still give you another lesser difficult question. So your graph will be going down. If you pass questions, your graph will be going up. So at the end of it all, when the computer is evaluating the minimum number of questions, it will be looking at, have you answered more difficult questions, whether you have failed them or not, or passed, or you have answered more easier questions. So at the end of them, your minimum, if you have answered more easier questions, you fail the exam. If you have answered more difficult questions, you pass the exam. So that's how the computer algorithm operates. And that's how it determines whether you have passed or you have failed. So that's one thing that is not changing. The next thing that is not changing in the Nclex is the current question types. The question types that I have just shown you, those ones that are on your screen right now, are not changing. So they can be brought. You can get them in the Nclex. So all these, you can get a multiple choice question, selector that apply will be there, hotspot will be there, audio will be there, videos will be there. They can show you a video and ask your question. Multiple choice with graphics can be there. Drag and drop can be there. Fill in the blanks will be there. Okay, so that is not changing. So it's not that the exam is changing entirely, but the style of the exam is changing entirely. Okay, so let's now look at what is changing. What are the new changes in the Nclex? All right. So the time remains 5 hours. You have 5 hours to do a minimum of 85 questions and a maximum of 150 questions. All right. So your exam can stop anywhere between 85 questions and 150 questions. Some of you will do 85 questions, others will do 150 questions, others will do between 85 and 150. The computer can stop anywhere between 85 and 150 after it has made a judgment that you have passed. Now, 52 questions from the 8 content areas. We have content areas in the Nclex curriculum. The Nclex has a curriculum. Nursing is very wide. So the NCSBN has developed a curriculum for the Nclex, the areas that they test, and they have divided it into 8 content areas per the newly released guidance for 2023, the latest one. So of the 85 questions that we'll be doing, 52 questions will be coming from the 8 content areas. That means for you to pass the Nclex, you must be very good with nursing content, specifically Nclex content as per the curriculum for 2023. Of the 85 questions, 18 questions will be 3 clinical judgment case studies. The case studies that are coming, are being brought in the new generation Nclex will be having 6 questions per case study. So that is one major change that has not been the Nclex. So if they are bringing you 3 clinical judgment case studies, and those will be considered as 18 questions because each question has 6 questions in it. So if you add 52 and 18, that gives you, I think, 70, and you are going to 85. So you have 15 items remaining. These are unscored pretest items. They don't score the 15 questions. These questions are research questions for the next Nclex that will be done, will be implemented in 2026. So even in the current Nclex, people have been doing a minimum of 75 questions. So of those 75 questions, as I have listed here, 60 questions were scored. 15 questions were not being scored because they were pre-test questions or research questions for the new generation Nclex that is coming up in March 2023. So even you, when you go to do the Nclex, you will do for them 15 questions for their own research. But these ones will not be scored. But the problem is you will not know which questions. So you will still have to do them and pass them if you want to pass the Nclex. Now, all breaks are included in the 5-hour limits. The Nclex gives you 2 breaks within that 5-hour period. If you have to be there the whole of 5-hour period. And those breaks are included in the 5-hour limit. So if you go for a break for 20 minutes, you are eating into your time. So it's upon you. But if you don't go for break, and maybe you are pressed with a full bladder, and the blood now will start stimulating your sympathetic system, you'll not be able to function well, then you'll not be able to answer questions well. So it is not a question of whether you go for a break or not, but it's a question of how do you manage your breaks. In fact, apart from the 2 breaks that are given, you can ask for another break if you feel that you are not concentrating and you save yourself from failing that exam. Like for guys here who are not who are not South Africans, you know that you have to travel all the way to Johannesburg, and you have to do you have to pay for air ticket, a lot of money, and that is it's very important therefore that you go and pass the exam. Okay. All right, so let's look at the types of questions that you will be expecting in the Nclex, the new Nclex. What is changing? So among the case studies, we will have different types of questions, which I'm going to show you today. Now, the main question that's coming up is a case study, case scenarios. A case will be presented with patient data. Then you will be asked questions from that patient data. Actually, if I can take you back, one of the other reason why the Nclex is changing, the NCSBN has said that they want to make the Nclex as real as possible. They want to present you with like real client scenarios. They want to see how you can manage a patient. So in my own perspective, one of the things that is happening with the Nclex right now is that the person who is going to pass this Nclex, the new generation Nclex, has to be a person who is practically thinking about the patient. Your perspective of thinking must be about the patient as a nurse. This is where real nursing is. And it's real nursing that is accompanied with a lot of knowledge. You must be knowledgeable. You must be knowing how to respond when the situation of the patient changes. Because these case scenarios, what they are doing, they are, the NCSBN or the test setters, they are playing with patient scenarios. You are treating a patient who is aspirating at 80%, 80% in terms of oxygen saturation. And then you're expecting them to improve after giving oxygen. You give oxygen, they are not improving. What are you supposed to do next? Or maybe you are doing a CPR, you do breaths, you do chest compressions, your patient is not improving. What are you supposed to do next? So the person who has to pass this Nclex has to be very knowledgeable in terms of patient management. That is where they are heading to. And actually, it's not far, April 1st. So let's look at the kinds of questions that can be asked in these case scenarios. Actually, case scenarios is not a type of question really, but this is a major introduction to the Nclex. Most of the question types now will be asked from the case scenarios, the data that will be given. So one question type is an extended multiple response. This is a SATA. Select other apply question, the one I talked about. But now the difference between this one and the previous one is that in the new generation Nclex, they are going to give partial marks. So if you get some questions right, they give you marks for that, even if you leave some others that are right. But at the same time, if you answer if you give some wrong answers in a SATA, you get negative marks. All right. So that's the change. So even though there will be partial marks, it will be very important for you to give correct answers. Okay. The next type of question is an extended drag and drop. This will be similar to the current, but with more options, some of which will not be used. So in my opinion, it's like they have made this one a bit harder, because in the previous Nclex, the one that is current now, there were drag and drop questions, but you were to use all the options. When you are ordering, for example, showing the steps of a procedure. In the new generation Nclex, they will give you like 10 options to order in a drag and drop question, but you're not going to use all of them. You will use like 7, but they will not tell you how many you are going to use, okay? And some of them probably will be looking similar. For those of you who have done IELTS, I think I can give an example with that. If you have done IELTS, especially IELTS reading, where you are supposed to give headings for paragraphs, they want to give you like 5 headings, but they give you 7 options. So that is what is going to happen to drag and drop questions in the Nclex, new generation Nclex. So they give you more options, but you're going to use like less of the options. And you don't know how many, and you don't know which ones, all right? The next type of question is called a drop-down question or a clause. So this one will have, the drop-down may have more responses. So I'm going to show you this. Is whereby you have, it's actually like an options question. You just click the drop-down arrow, then you choose, and then you leave it there as the answer. The next one will be a matrix question, clinical data provided in a chart or table for candidate to make a decision. I'm going to show you that. The next one is an enhanced hotspot. A hotspot that is a bit more complex than the one we had in the previous Nclex. So the bottom line is, are these people making the exam harder? I don't think so, and I don't know. Maybe I don't know that. But what I know is that what they have said is that they want to make it more realistic in terms of nurse-patient interaction. Okay. All right. So how do you pass this Nclex? How do you pass this Nclex? The decision to change the Nclex is not for you to make. It has already been made, and the Nclex is going to change. All right. There's a lot of information about the current Nclex anywhere in the internet, with your friends who have passed Nclex, with your friends who have not passed Nclex, with your relatives in the US, with your linkages in YouTube. But we don't have a lot of materials for the new generation Nclex. And in my own projection, we will be having enough reliable material for the new generation Nclex, maybe after 1 year of implementation, maybe in 2024. Does this mean people are not going to do Nclex? No, people are going to do Nclex and they are going to pass, because the content is the same. The content has not changed. So when you have someone who is very good at patient management, at the level which the US requires, this person is going to pass Nclex, because what you're having are the case studies for the patients that you manage in the ward. So you have to do intense review of nursing content. You must be knowing what you are doing. You must be smart, but you cannot be smart without doing intense review of the content. You must know what you're supposed to do. You must know that. Please underline the word must. Reviewing as many Nclex types questions as possible. This will help you to have the intense knowledge I'm talking about. And then you can join a training institution. There are those of you who want to be trained by a friend. It's okay. I don't know whether that friend will have enough time to train you, but people are very different. So that one I leave to you. But what we do at Passcode, we do everything to ensure that you are prepared very well to go and pass the Nclex. Walking the journey with a mentor. Yes, you can have a mentor, because this journey is not easy. You are revising for I will not say a very hard exam, but I will say a very demanding exam. At the same time, you have a family to take care of. At the same time, you have a job to take care of. At the same time, you have bills to pay. You have other costs, and you also have costs for the Nclex. Whether you are being sponsored by an agent or you are doing self-sponsored program like the one Nclex offers, you will still need money for this process. All right. So let me now show you the types of questions. Now, if you look at my screen, courtesy of NCSBN, you will see this type of question. So let me try to show you this question. Don't know, just a minute, some Zoom tabs are blocking me from view, so I want to remove them here. Okay, so look at this question. This is one of the type of question that I was talking to you about. So the question reads, the nurse in the pediatric unit is caring for a 6-month-old client. Then the nursing notes are here. At this in some countries is called the nursing cardex. At 8 a.m. or 0800 hours, client admitted with increased irritability and a leaking gastrostomy feeding tube, which was placed 2 weeks ago for failure to drive, blah, blah, blah. So many things there, including the vital signs, a lot of explanation there. And then the nurse is reviewing the client's assessment data to provide the client's plan of care. The question is here now. Complete the diagram by dragging. So we talked about drag and drop question. Eh? So you can listen to what the question is talking about. Complete the diagram by dragging from the choices below to specify what condition the client is most likely experiencing. 2 actions the nurse should take to address that condition. and 2 parameters the nurse should monitor to assess the client's progress. So here you have action to take, condition most likely experiencing here, and then parameters to monitor. So you will come here, you can see you have been given 1, 2, 3, 4, 5. You have been given 5 actions you are supposed to take to choose 2. And then here, you are supposed to choose the condition the client is suffering from. You have been given 1, 2, 3, 4. So this is like an MCQ. This is like a SATA. So you can see the way they have played with the questions and blended them in one question. And then here you have been given 1, 2, 3, 4, 5 options. You have to choose 2. Which ones are you going to choose? It's upon you now to have the knowledge of this client to be able to know which action to choose. So this is a type of a question which combines many questions into one. It has a multiple response question here. It has a drag and drop in that you have to do that to drag. And then this is like an MCQ. You have 4 options. You have to choose one here. So let's go to the next example. This is another example. The home health nurse is caring for a 2-month-old client. All right. Nursing notes are there. Weekly visits. Visit 1, 10 a.m. The nurse took data there. Weekly visit 2, 10:30 a.m. Weekly visit 3. So you can see this is a duration of 3 weeks. The nurse has been following this client. So the question tells you, drag words from the choices below to fill in the blank in the following sentence. The nurse should anticipate that the physician will instruct the parent to, okay? So what choices? Fortify the breast milk, you drag it and put it here, if it's your answer. Complete a feeding log, if it's your answer, you drag it here. Feed the client formula for 2 weeks, drag and drop it here if it's your answer. Increase the client's caloric intake, drag it here if it's your answer. Consult a pediatric surgeon for placement of gastrostomy tube, place it here if it's your answer. So the thing is, you are not choosing all this, dragging them and bringing them here, and then you complete your task. No, you are dragging only the answers. Have you been told how many answers? No. So you have options 1, 2, 3, 4, 5. How many answers should you choose? I don't know, because you have not been told how many. You use your knowledge to choose the answers. If the answers are 3, you choose 3 correct answers, you get the marks for the whole question. If you choose 2 and you don't choose a wrong answer, you get 2 marks. If you choose 2 and 1 wrong answer, you get 2 minus 1, so you'll have 1, all right? So that's how it's being marked. Next example. This is a drop-down question. So the nurse in the long-term care facility is caring for a 19-year-old client. All the information, nursing notes is there. You can see there's another tab for history and physical assessment. There's a tab for vital signs. There's a tab for laboratory results. You are supposed to click and read all of them for you to be able to answer the question. Then the nurse has reviewed the nurse's notes from 11:30 and has collaborated with the registered nurse. Okay, let's see that. So the nurse should recognize that the client is most likely experiencing. So you will click select, then you will see the options: an infection, autonomic dysreflexia, an abdominal aneurysm. So you just click your answer, then it will be left there. Next question, sample. The nurse in the long-term care facility is caring for a 19-year-old client, like the same client, but that's the same client, but now these are different type of a question. So which of the following would require immediate follow-up? How many options have you been given? 7 options. Have you been told how many they need? No. So you come here and choose maybe respirations, pylor, erection, blood pressure, maybe the 3 of them. So this is what we are calling an extended multiple response. It's like a SATA. Another example, the nurse in the medical surgical unit is caring for a 38-year-old female client. You can see progress notes, physical history and physical examination, diagnostic results, laboratory results. The notes are there, the diagnostic results are there. Then they ask you this question. You can see now these are different type of a question. It's a chart. So they tell you, for each potential nursing intervention, click to specify whether the intervention is indicated or not indicated for the post-operative care of the client. So if it's indicated, you tick. If it's not indicated, you tick. But of course, for each, you have to choose whether indicated or not indicated. So you have to go back to your notes. All right. And that's the end of the presentation about new generation Nclex. I want to believe that you have learned something, and from today you understand very well the changes that are happening in the new generation Nclex. So without much ado, I wish to end my presentation.
Thank you very much, Humphrey, for that beautiful presentation together with Denise. So before we go to the main questions, what is asking Humphrey, is it possible for you to make summary? I've been making my own notes on my notebook, but is it possible to double a summary of your presentation? Like, this is what is remaining the same. This is what is changing. This is what was there before. This is what is new. Is that possible?
Yes, that's very possible, Donald, but I will tell you that actually what I have presented is like a summary. The NCSBN released about 50 pages document on what is changing. So what I have presented is actually a very summarized version of what is changing, because they are explaining what is happening in almost everything. So if you look at my presentation, it's actually very summarized to the extent that the finer details are not included. Those ones, we usually discuss them in class with the students. Learning about what is changing in the new generation Nclex is actually going to take us a whole week. That's 3 lessons for Passcode to explain what is changing. So it's that detailed.
Okay.
I think.
Yeah.
I think I'll.
Yes.
Is there somebody saying something, Kiki? So I think I agree with you, because some of us who work for USA-based firms which are using Kinsa or Oasis platform in management education, there is a new release which has been made, and actually these changes are very many, in that you cannot discuss them in one sitting. So probably those might want details of what have changed, what needs to be changed. Denise is going to share the contacts of Passcode in the chat box. Click it to pick the contacts and then contact Passcode. But now we are going to go to the questions. Make sure if you have a question, you've posted it in the chat box. But I'll begin with the first question that came in from there. We had the first question from somebody here about registration for Nclex exam, whether it's we can still use Joseph or Sinsley. I think there's a question we had tackled last year about using either Joseph or Sinsley or any other. Do you have a comment about that?
Yes. Yes, I do have a comment about that. So let me say that one of the things that people may not like, maybe myself included, is that the process of becoming a nurse in the US is not easy. It's complex, but it's worth it all. So the CGFNS and JSA, Joseph and Selene Associates, what they do is that they verify your documents, whether they are genuine, specifically the academic degrees, academic certificates, and the licenses. So should you use CGFNS or JSA, they are advantages and disadvantages of using each. But for us, what we do, we assess you and we discuss with you the pros and cons of each. Then we and you now, we choose which one is best for you. For instance, if you you started with a certificate and then you did a diploma, we prefer one against the other. If we will tell you which one if we assess after we assess you. If you want your report to come out very quickly, we prefer one against the other. So we have to do an assessment. So once you come seeking our services, because we help people to register for JSN and CGFNS, the moment you have paid our fee, which is a small fee for the service, we give you a list of information that you are supposed to gather. Once we look at that information, we are able to determine which one is the best for you. So we sit down with you, we do a Zoom meeting with you, and we discuss, and you're able to see the sense why you should use JSA and not CGFNS, or the other way. Thank you.
Thank you very much, Humphrey. And that's quite important about registration with the CGFNS, which pathway should you take? Then the direct question that will come after that one, as obvious, is the fee. And I know as we talk about the fee, we also have our colleagues from Nigeria. I see Zachary is here. I see Hadija. I see Modolupe Mary is also here. Good friends from the West. They charge the fee for your services. That is, are you able to break down how much do you charge for training for Nclex exams, facilitating registration with the CGFNS, and any other charges that are probably maybe related to your services or maybe incurred by clients as they seek your services?
Yes, we are able to break down the process, and most of the clients who have been asking us, there's a brochure we usually send to them. And apart from that brochure, we also go further to explain these charges. But maybe in a nutshell, I can do a breakdown very quickly. So when you come to us and you tell us that you want to do the Nclex registration and revision service, I mean, you want to be registered as a nurse in the US, simple. The first thing you do, we ask you to do, is to pay a fee of $50. We'll use dollars for the sake of the clientele I mean, the people who are in the meeting right now. So you can convert that to your currency. We charge $50 for the CGFNS service. What does that $50 enable us to do for you? We build your CGFNS profile, the whole of it. CGFNS profile is a 10-page profile, which you have to be very careful when building it. People have come to us, we cannot reveal about our clients, but CGFNS is very sensitive. People have purchased the wrong service with CGFNS, and they operate on a no refund policy. When you're paying CGFNS, even if you pay them, the money is deducted from your account twice. They can't pay you back. So people have paid to the tune of $750 to CGFNS because maybe they didn't know which service they are supposed to buy. So the whole process of CGFNS, we do it for you at $50. So we build your profile. We do a meeting with you because we build a profile together with you. I mean, you are always updated what we are doing. We do a meeting with you. We show you how to use the profile. We show you how to log in. If you put wrong details, it's automatically locked for 48 hours. If you put wrong details again, it's locked for 1 week. Then it will go for 1 month. And you cannot do anything. You have to wait. So apart from that, after showing you how to use it, we also show you how to pay for the service, the CS report. So you log in and pay. So after paying us the $50, the $450 for the CGFNS, you don't pay to us. You pay directly to the CGFNS using a Visa card. Then from there, we download the forms, we give you the forms. You take to your nursing council and to your school of nursing. Then from there, we will advise you to join the Nclex revision program, which we charge $300. And that $300 will have you benefits of an Nclex revision program for a period of 4 months. So if you are becoming a student, you become our student for 4 months, you will be in the program. We will be supporting you in this sense. One, we will give you revision materials for the Nclex, for the content. We will give you revision questions for the Nclex. You will be able to attend a class, 3 classes every week on Monday, Tuesday, and Friday, East African time at 7 p.m. For those who are not able to attend the class once in a while because of work-related issues or any other issues, all our classes are recorded, and we give you a link to the site where you are able to view what was taught in class. In addition to that, we have a platform online, an online platform for learning, where you can access previous classes, you can access notes, you can access important resources for the Nclex. So during the process of the 4-month Nclex review course, we will again do a meeting with you for free and explain to you the next steps you are supposed to be taking. That includes registering with the Board of Nursing. For that, we charge $30. And for most of the boards, you will be charged less than $50 to register. And some of them are 100 actually, others 75. And also you will be required to register with some bodies in the US that deal with criminal history investigation. You send your fingerprint cards to the US. So the $30 you have paid us for the board registration will still cater for that. We will guide you on how to do your fingerprint registration and send them to the US. After that, we are going to help you to register with Pearson VUE, and we charge $20 for that. So we help you to register with Pearson VUE, and you're able to schedule your exam. Then from there, we are going to support you for free on how you're going to travel to India or South Africa or London or Manila, where we have nearest centers from Africa. So the cost that you're going to spend now, that the ones that you're not paying to us, at the beginning, you're going to spend about $450 to the CGFNS for verification of documents. And for those who are doing JSA, currently the price is $380. So then from there, you are going to spend about $100 to register with the Board of Nursing. You're going to spend an unspecified amount of money to your School of Nursing and Nursing Council, your Nursing Council. That one I cannot say how much, but for Kenya is 12,000 Kenyan shillings for the Nursing Council. Schools vary. Then from there, you are going to spend $200 to register with Pearson VUE, and you're going to spend $150 to schedule your exam. Apart from that, the biggest chunk of money you're going to spend is the air ticket and accommodation to South Africa. So ours is purely a self-sponsored program. You sponsor yourself. So if you want to sponsor yourself, you need to have about $1,200 to start the process, $1,200, or let me say just $1,000. You need to have like $1,000 to start the process. Then at the end of it all, you need to have like $1,200 to go to travel to South Africa or India. So at the end of it all, the whole process is going to cost you about $2,500, something like that. Now, as I end, why should you do the self-sponsored program? Currently, many nurses go to the US through agents who finance them. These agents are very good because they finance you fully. Of course, they don't pay some of your charges. Some of them will not even take you to South Africa. They tell you, go, you sponsor yourself. When you pass, we will refund you. The models are very different. Others will, of course, no agency is going to pay your CGFNS, I mean, your Nursing Council fees, traveling fees, sending documents to the US. You still have to use a lot of money by yourself. But one thing that is common with these agents is that they're going to bind you with a contract for about 3 years, most of them. And during that time that they have bound you with a contract, mostly, for most of the agents, you may not know your pay with the hospital you're working with. So what they do is that they they negotiate for a fee, and then they pay you part of the fee. So for 3 years, every hour you work, they have to get something from you. So why are we encouraging the self-sponsored program? If you pass Nclex today and you want to go work in the US, you can go through a route that we call direct hire. These are new modern agents that are coming up, and they are already in the market. And what they do, they link you with a hospital, an employer. You negotiate directly with a hospital about your pay. So that means, obviously, your pay is going to be higher than the traditional agents. You also negotiate about your contract. If you don't feel to start with a contract of 3 years, you can start with a contract of 2 years. So we cannot avoid agents, because for you to go to the US as a nurse, you must have an employer who is your sponsor for the immigration process. But now the direct hire agents, they sponsor you for the immigration, but they don't want to take from you for every hour you work. So for them, they are paid by the hospital on a commission basis. Then you become a hospital employee. Apart from that, you can be able to attract a very good hourly rate, and you can be able to attract a sign-off bonus when you have already passed the Nclex. A few months ago, one of the agents, which I will not mention, is a traditional staffing agent. They do sponsor nurses before they are done Nclex, but they're also taking in nurses who have done Nclex, because doing Nclex is the main thing. So when you go tell them that you have done Nclex, all of them want you. So a few months ago, that agency was giving $5,000 sign-on bonus. So even if you spend your $2,500 doing this Nclex and you pass, you can even say, I've exhausted my resources, so I want someone who is going to compensate me. But I will ask you to be careful with that, because what you should be looking at, this is actually free information that is very important. What you should be looking at is your hourly pay. Because an agency can come here and give you $5,000 sign-on bonus. If you convert that money to your currency, it's a lot of money. So you get attracted. But what you should ask yourself is, how much am I going to be paid per hour? So if they are giving you a good pay per hour, even if they are not giving you a sign-on bonus, that would be the best, if you ask me. So the money to sponsor yourself may look as if it's high, but I want to tell you, if you sponsor yourself, for those who have already sponsored themselves, what you should focus on, don't focus on the money, focus on passing the Nclex. Please, when you sponsor yourself, invest everything, your time, to make sure that you pass the Nclex, because you'll be happy after passing the Nclex. That money is about, is actually a 2-week check, $2,500. That's a 2-week check in the US. So if you're able to go to the US and work for 2 weeks, you'll be able to recover all your money that you used in sponsoring yourself for the Nclex. And I can assure you that. So passing the Nclex is the main thing if you want to go work in the US. How you will pass it, then now it's upon you. I know some people will have a challenge sponsoring themselves. It's okay, you can go to the agent. And we actually also help people to go to the agents, to get an agent to sponsor them. We do that. At a small fee, we're able to take you through all those steps. Because from where I sit, I've interacted with so many nurses and helping so many nurses to navigate this journey. So I know what I'm talking about. And I can tell you that even getting into these agents is not easy. It's very competitive. These agents are getting nurses from all over the world, with Philippines leading, getting thousands and thousands of nurses to the US. This year, 2022 and 2023, Kenya is taking about 2,000 nurses to the US, the highest number we have ever had, but the Philippines is taking tens of thousands to the US per year. Congratulations, Philippines, for those of you who can hear what I'm talking about. Yeah, so that's what that's the whole process. Thank you, Donald.
Oh, wow, thank you very much, Humphrey. I think that has been very exhaustive, and you've answered even some of the questions I was going through in the chat box in terms of the timeline. What are the timelines for your training program? And that has been quite a summary for us who are in the meeting. Is there anybody whose question has not been answered? If there's if it's there, kindly please raise it in the chat box. But meanwhile, if we come to the end of the meeting, because we should be closing by 9 p.m. sharp, that is by 6 p.m. West GMT, or 7 p.m. West African time. I don't know about Philippine time. I want to invite a few reactions, and you'll allow me to be a little bit biased. We had attendance from Philippines, we had attendance from West Africa, and attendance from Asia. I'll begin with West Africa. If you're from Philippines, I think I saw 2 people from Philippines. You can raise your hand if you would like to give a reaction or a vote of thanks. But from West Africa, we have Zachary, a good friend, Nas Zachary from Nigeria, and Hadija. Let me begin with Zachary. Zachary, if you're in the meeting and you're able to hear me, can you please unmute and give a reaction? Yes, Zachary? Ruben, that is you, Ruben Zachary. Zarangi,
Okay.
sorry, Ruben
Okay,
Zarangi.
I've been hearing Zachary.
Zirangi.
Yes,
What is Zachary?
No, that's Zachary. It's Ruben Ezragi Marcos.
Yes, Ruben, that's Ruben. Do you have a reaction?
Okay, thank you very much for this wonderful presentation. It's really worth it. And this is apt because a lot of our young nurses are eager to practice abroad, and I consider it as a way of learning and coming back to your country to invest, because you will be convinced with me that the developed countries are more advanced in terms of nursing care than us. So having been there will provide us opportunity to rub minds, to learn a lot, and come and invest in the nursing in our country. And I'm very glad you guys have made it possible and easier through the Passcode agency or union or organization to explain and also present to us the channel, the easier channel to get it. So sorry, I couldn't introduce myself. I am Nos Ruben Marcus Draghi. So people might be surprised by seeing the NR before my name. The NR is the abbreviation for nurse, which I initiated some times back and have been advocating for its use. So I'm the contact person of African Novice Nurses and Student Initiative of West Africa. I'm the former president of the Nigerian University Nursing Student Association. Thanks once again, and I'm happy and glad to meet my fellow colleagues, fellow nurses from West Africa and Kenya in particular. And thank you for the presenters and Passcode Union. Thank you.
Thank you, Ruben. It's always a pleasure to interact with you since we last interacted in last year. That should be around July or September thereof. And I'm going to invite your immediate successor, that is Hadija, who has been the most recent, if according to my knowledge, the most recent president of Nigeria University, University Nursing Students. Hadija, are you there?
Yes, I'm here. Good evening, everyone.
Good evening,
Donald. It's nice connecting with you once again. I would like to appreciate you and then the fellow presenters for the wonderful presentation. I must say that I've learned a lot. I've actually attended some other classes on Nclex, and I must say that I've not really seen one that was as detailed as this. So thank you very much, and please do not forget to reach out to us and then invite us next time in case you have such programs coming up. Thank you very much, and have a good night.
Thank you very much, Hadija. I look forward to seeing you people getting more of you joining our Passcode for training programs for Nclex, that we may lift very many nurses to the United States of America and other affiliated countries. We also had somebody from Philippines. Do we have somebody from Philippines? I saw someone in the chat box. Are you still there? Okay, if we don't have anybody, that is Ibarra. Ibarra, are you still there? Ibarra, if you're still there, you can unmute then give you a vote of thanks or a comment. Okay, very well. Then I'm going to take maybe the last comment or the last vote of thanks from a very senior person that I respect. That is Nurse Morris. Mr. Morris Opetu is a senior nurse in Kenya and the Deputy Secretary General for Kenya National Union of Nurses. Mr. Morris, if you are there and you are able to hear me, are you able to unmute and maybe give a vote of thanks or ask a question or a comment? Yes, please, Morris. Okay, very well. Then maybe the last one, I'm going to take it from I'm sorry if I just take a random name. I see Anyeni, if you are there, Bosibori. Okay, Bosibori is not there. Let me just pick one more person who has been active in the chat box. That is Shadrach. Shadrach, I see you've been the most active member in the chat box. And I would like to give you an opportunity probably to give a comment or a vote of thanks or a question live. Are you there, Shadrach?
Hello, thank you everyone for your time.
Yes, Shadrach.
Yes, my name is Shadrach and I'm a nurse working in Bomet County, and I'm so grateful for your time, and I'm really eager to join for classes, and I've been asking questions regarding to the classes and how to join, and thank you so much for the sessions. I've learned a lot concerning the Nclex, and I think I'm the one in class soon. Yes, thank you so much, Ampre. Thank you for everyone, and see you soon. Thank you so much for your time.
Thank you, Shadrach. For Winnie, you are asking, Winnie and Victor, you're asking how can you access the recorded the recording. This recording will be uploaded in the YouTube channel for Passcode Global Consultants. You can as well still access other recordings of the 5 meetings that we did last year, still on the YouTube channel. Once the recording is complete, I'll be able to share with you in our in the WhatsApp groups and also on Twitter. So be on the lookout. But otherwise, I also want to thank you very much for your time and attending. I'd like to finally invite Mr. Humphrey and Dennis. I'll begin with Dennis to give the final remarks or the call to action. Then we close the meeting in the next 1 minute. Dennis, your call to action.
Okay, thank you so much, Donald. Thank you everyone for finding time and joining this section. This section are prepared free of charge so that maybe you can get some insights on Nclex process and all that you are required to do. So my call to action is basically to urge you that are planning to start the Nclex process and journey. We are here for you. We are here to work with throughout the process up to the time you become a USRN, and also further up to the time you are an employed staff at the US. Our next intake is ongoing. Our orientation classes are beginning on 16th. And in case of anything, you can check your chat box. I've shared our contacts. Thank you, everyone. And have those who are in Kenya, have a wonderful evening. Thank you, Donald.
Thank you very much, Dennis. As you can still equally again share the contacts so that the more questions that are coming in can be answered in the back door. Then have your call to action.
Okay. Thank you so much. First of all, I want to appreciate you so much for coming to this meeting. We usually value you so much, and we know that without you, the meeting cannot be a success. So just a comment before I make my call to action. Someone asked whether they can join online because they are not in Nairobi. I want to inform you all that our Nclex program is purely online. More so because we are dealing with nurses from different parts of the world, and we are also dealing with nurses who are working. In fact, we have nurses actually who are working in the UK and doing the US process in our program. And in our November results, we had one of the nurses who is already in the US studying there, but opted to study with Passcode. So yes, it's online, you can join. My call to action will be like this. It's not a must you go to the US or to the UK or to Australia or Canada because nurses are needed there or because your colleagues are going there, all right? But if you want to go, then what are you waiting for? Recently, like 2 months ago, there was an outcry for nurses from Kenya who are going to the US because of the backlog at the embassy. Today, as we talk, the backlog has been reduced by about 80%. The nurses who are going to do the process in 2023 will take lesser time. And that is something actually the new ambassador promised. So we were saying 2022 is your time, but I can tell you your time is better in 2023 than even in 2022. So if you want to start the process, you can reach us and we are going to help you to start the process, whether you are doing the self-sponsored program that Passcode offers or the agency program. So I want to wish you the best and share the information with others who have not been able to attend. Thank you very much.
Wow, thank you very much, Sir Humphrey. And I think as we close the meeting, I also want to give my closing remarks. First of all, I say thank you, all of you, for attending this meeting from wherever you are. Remember, our meetings are always free of charge. We give information free of charge. And another thing is that if you want to go abroad, the time is now. Do not wait. For those ones who are in Kenya and also for the benefit of Africa, last month, the President of Kenya, His Excellency William Ruto, was in the USA, and the conversation around there is that they want to set up an Nclex setting center in Kenya. So if we have an Nclex setting exam or an Nclex testing exam in Kenya, then it's already a plus for us nurses in Africa. You'll have to choose whichever is cheaper between going to South Africa or India or coming to Kenya to do your Nclex exam. So I want to wish you well and wish you a prosperous 2022. I look forward to meeting you in our next meeting. And hopefully in our next meeting, you'll be somewhere in your journey towards becoming an USRN.